What is your undiagnosed strange physical problem that doctors can't find an answer for? Sleep issues. I have done 3 sleep study tests and 2 tests for narcolepsy and they can't figure anything out. I am always tired no matter how much I sleep, and when I have done the overnight tests I always joke with the techs that I am gonna melt their machines once I hit REM sleep. When I wake up they say you weren't lying. I can tell you dream most of the night. I sleep so hard and I'm always tired. Dreams every night and all night usually. I have 2 lumps on the bottom of my foot. They have been surgically removed twice and still came back. Biopsies were clean. One podiatrist said they were probably impacted sweat glands, but 2 others said probably not. They had reasons I don't recall. Imagine 2 pea-sized rocks permanently embedded on the bottom of your foot. It hurts to walk most of the time. Look up hyperkeratosis punctata. Might be your issue. I had erectile dysfunction for about 3 years in my 20s. My sex drive was just as high as always, but I could never get it up without taking some Cialis. Not even a lot, like 2.5 milligrams. But if I didn't take it, I just couldn't do anything. I was stumped for a very long time. Checked my testosterone levels, saw a therapist, started working out more, took vitamin D supplements. Nothing seemed to help. Meanwhile I gotta go to the bathroom half an hour before any sexual encounter to take a freaking dong pill. It was messing with me so hard, especially at that early age. 3 years into this whole ordeal, the back acne I have had since my teens really intensified and I went to a dermatologist. It turns out I have had a raging bacterial infection in my skin the entire time. I had to take antibiotics for 4 months before it cleared up. But, much more importantly, within 2 weeks of starting the antibiotics, my dong was working perfectly fine again. Stood up on command. Not a problem anymore. Later, I found out that the occasional nosebleeds I experience were also a result from a long-term bacterial infection in my nose and got rid of that too. Life has never been as good. Whoa, that's wild. Occasionally I get an extremely sharp pain in the left side of my chest preventing me from breathing at all. X-rays came up clean and my breathing is perfectly normal otherwise. My ears get irritated, easily punable, very frequently. It spreads into my jaw and makes it hard to eat, sleep, talk, live. I've seen several ENTs and other specialists about it and they just give me ear drops that temporarily fix the problem. Maybe someday I'll figure out what's going on. I get severe pain in my ribcage under my left breast. It can get pretty bad. I've been to the doctor and there's been no identifiable cause. Have that too. Most likely it's a slightly deformed nerve that gets squished by certain movements. Been to the ER thinking I had a heart attack at 14 because of this, lol. If I lay propped up, think little kid laying on their belly coloring. My legs go numb. No visible reason why. Doctors are just like, well, don't do that. Sounds like pinched nerves. Caveat: I did get a diagnosis. I spent about 4 months in my early 20s with excruciating, but intermittent joint pain. It was like glass shards grinding between my bones, my knees, ankles, hips, elbows, and lower back. I would wake up in the morning and cry while I was trying to bend my legs enough to step into the shower. I was severely depressed. I went to rheumatologists, and they had no answers. My inflammation markers were enough above normal that they believed me, but not scary high. They tested me for Lyme, hepatitis, RA, etc. Turns out I had a bad seal in the trunk of my car, which created a puddle in the hidden area with the spare tire, which grew mold, soaked in bleach, dried on a sunny day, and my symptoms went away slowly over a couple weeks. Funny thing is that they asked if I was being exposed to mold, but I didn't have any reason to think that I was, which led me to wonder in retrospect, how many people don't know that is what is causing their problems? I have an itch right in the middle of the bottom of my foot. I've been to doctors and dermatologists and there is nothing they can find wrong with it. It only really itches at night, but it will get so bad I want to like rip through my skin. Best guess is it's something in my nervous system, but that is just because my doc had no other explanation. I'm tired all of the time, no matter how much I sleep. I could fall asleep anywhere at any time if I just had a minute to close my eyes. If the alarm didn't wake me up in the morning, I could sleep straight through until the next morning. Probably unrelated, but also weird, is that I have spells of not being able to get warm. If I get one of these cold spells I could go stand in the Florida sun in a parka and still feel freezing cold. What gives? A mystery allergy to something. I've eliminated everything possible. Now I've given up. Doctor did a biopsy to see what it is. Yup, I'm allergic to something. It's a skin allergy. I no longer use lotion. Switched body wash over 20 times. Switched shampoo conditioners. Switched laundry detergent. Now I only wash my clothes with vinegar. Still no change. Sometimes I can feel my heart trip up, like it actually misses a beat, then has 3-6 super hard beats before getting back to normal. My doctor says it's nothing but it feels like I'm about to die. I can sometimes hear my neck. It sounds like liquid passing through a tiny opening. It's so strange. Doctors listen for it but nothing ever comes to it. I get this sometimes too. The sound comes from the back of my head and seems to travel down my spine until about halfway down my neck. I kept having recurring stomach pains at random with no recognizable pattern or trigger. First time was Thanksgiving 2 years ago. Thought I had just eaten too much and was in mild pain that night. Still felt a little off the next day or so but went back to normal. Happened a few more times until last summer when I had to go the year because it was so bad. I've had CAT scans, drugs, blood work, upper endoscopy and still no answer. It's like someone has lit a fire in my stomach and also a little like being a balloon about to pop. I never could connect it with a food or ingredient, and it was never regular. Sometimes twice or more a month and sometimes I'd go 6 or more weeks between episodes. The last time was literally the day I found out I was pregnant and I haven't had an issue since. Which is nice. I'm almost afraid to have this kid because I don't want to have the painto start up again. Ugh, that reminds me of gallstones. Abdominal pain is so vague it's hard to pinpoint. Took me 4 attacks before I was able to determine it was the gallbladder. We finally found the solution for my weird medical symptoms. First I started having migraines 9 years ago, nearly every weekend. Then I started getting bad stomach symptoms in the morning after eating my cereal. Thought maybe intermittent lactose intolerance was a thing. Lived with that for years. Then my dad died and it kicked things up a notch. Couldn't stay hydrated. Upset stomach and diarrhea daily. Terrible canker sores that made my whole face throb. Exhausted all the time. Terrible anxiety. The doctor gave me acid reducing pills for my stomach but they were only helping a bit. So I started experimenting with my diet. As it turns out, I'm a celiac. After 2 weeks without gluten I started getting better. I remember waking up from a nap one afternoon and not having a headache and thinking, do people normally feel good when they wake up? Felt amazing until I accidentally glutened myself for 3 weeks by not knowing that the chocolate chips at Starbucks actually contain cookie bits. All my symptoms came back and now I'm working through the 2-week period after going gluten-free before I start feeling better again. The first paragraph I knew that's what it was going to be. I'm sorry you have it but I'm happy you figured it out. Not a doctor. Childhood friend's mom developed celiacs post-pregnancy and became head of the local chapter of the Celiacs Association. Freaky slow heart rate. I'm in pretty good shape but not a super athlete or anything. Typically my resting is mid-40s. When I first realized this I was at the doctor's and they did an EKG and my heart rate was 38. I was freaking out. The doctor, though it was funny, he gave me the EKG as a souvenir. I had patches of rough skin underneath my eyes. The skin started to itch when I was about 8 and I could never really explain how they felt to my parents. We went to the doctors who would prescribe different anti-itch creams for the patches to see if they would work and sometimes they got me to stop and sometimes they didn't. I got glasses simply because they would hide the patches sorta when I was wearing them. It took one visit to a dermatologist when I was 16 for her to tell me I had eczema. How annoying to put up with something so simple to diagnose for so long. Same happened to me but the itchy skin was on my eyelids. None of the creams could go around the eye, but I found that Visine allergy helped a lot. Sometimes I get a random shot of pain in my ankle when I run, jump, or anything that puts pressure on it. After that, the pain goes away like it was never there to begin with. I have it in my right ankle when I first take off to run. It pops funny and hurts for a moment. Then I literally shake it out. After that I can run normally. After my daughter was born, I had incredible hip pain to the point was walking around with a limp. Had an x-ray of the hips, pelvis, spine and it showed early arthritis. Yay. I thought I was afflicted like my dad was at a young age. Move on with my limping life and start taking Motrin. Fast forward a couple years. Find a Lyme tick stuck on my leg. Remove it. Take it to my trusty doc and get treated with like a month's worth of Doxy. Hip and pelvic pain resolved. So the treatment for Lyme resolved the joint pain. I was being treated prophylactically because of said Lyme tick and it turns out I actually had it to begin with. Go figure. I have a rare condition called idiopathic intracranial hypertension. Basically my body produces too much cerebrospinal fluid and or doesn't get rid of it fast enough to keep up with the amount it produces, putting pressure on my brain and optic nerves. The funny thing is it was found on accident. My mom got a better job and I finally had decent vision insurance, so I wanted to have my eyes checked as a preventative measure, even though I've always had good vision and never needed glasses. The poor optometrist was freaking out and told my parents they needed to take me to the OB because my optic nerves were so swollen, which apparently is a sign of a brain tumor. 12 hours later I was the proud owner of a rare disease. There was a time when I lay down my entire lower half would start cramping up. I went through every test imaginable. Doctors couldn't figure out what was causing it. The cramps were so painful. Finally had an iron infusion and the cramps stopped. OMG. It was not pregnancy. Finally had an iron infusion and the cramps stopped. Iron and or potassium deficiency are generally the main causes of these. I get it in the summer sometimes and once I get both into me it dissipates. Memory loss, seizures, migraines. There's so many freaking symptoms and it made my life heck. I sometimes get a pain right behind my belly button, as if it were hooked to the end of a cord. If I stretch my stomach or move suddenly it's a blinding pain. Feels muscular not digestive, and I can't seem to pinpoint a trigger. It'll happen every few months and go away after a couple of days. Any doctor I've asked just looks at me blankly and shrugs it away. Baffling. I think it might be an umbilical hernia. I have that and experience similar things. Terrible pain from time to time, from tissue getting trapped in it. That goes away after a while, and usually touching my belly button is a very unpleasant sensation. I think there's a surgery to fix it. I'd suggest googling it if you want to find out more. Female. NSW comment. Any form of vaginal or clitoral stimulation provides absolutely no pleasure, sometimes even pain. It was determined I have pelvic issues, but that doesn't explain the clitoris. It just feels like nothing when it's touched. Fingers feels like something, just not pleasure. Sometimes numb. Vibrators, nothing. Showerhead, OWW. I technically orgasm, but no pleasure comes from it. It just feels like a few weak muscle contractions. It takes forever too, sometimes a few hours. I'm in my late 20s and I've been asking doctors for years, even when I was a teen. The usual advice is relax more, drink wine, find a partner you're truly comfortable with. My partner is me, and I'm definitely comfortable with myself and relaxed. I finally found a doctor that had me try various hormone creams and even that didn't work. For years I was really depressed about it and felt seriously defective. I still feel bad about it every now and again and wish I could figure it out. It really stopped me from wanting to find a romantic partner. The fear of rejection is real. I finally got relief, but for 2+ years, I had pain and sensation in my left testicle and penis. Sometimes severe but always present in some form. At first, a local Midwestern physician treated me for epididymitis. I had a bit of short-lived relief, and even went through a second round of antibiotics. After the pain came back, I saw a couple urologists and another physician. The first one had checked out. One told me it was psychosomatic and would go away in 6 months. A second urologist refused to do an ultrasound because he thought I was just paranoid. The second physician had mentioned a Varicocele, basically, a varicose vein wrapped around and squeezing your testicle, but neither urologist thought anything of it. I lived with this pain for another year or so before moving to Los Angeles. I instantly found an awesome urologist who speculated it was a varicocele, then scanned me to confirm, you know, like how a reasonable doctor would do. I had a varicocelectomy a couple weeks later, and I've been fine for 15+ years. 4 years ago, I lost feeling in my right hand from the wrist to my fingertips. It will lock up in whatever position it likes at the time, mostly closed in a fist. If not, I have to force it closed so it's slightly more comfortable. And I lost all strength in the hand and wrist. I have a neurologist who, after doing multiple MRIs of the head, neck and shoulder to rule out pinched nerves, MIS and the like, and multiple nerve conduction tests, told me he can't help me. I have stumped 4 doctors, including one specialist for something to do with blood, who spent less than a year with me while my hand was locked and told me there's nothing he can do. About a month and a half ago I snapped something in my wrist, and the feeling has come back to the point where my palm is getting ticklish. Always had ticklish palms. We have discovered that acupuncture gives me feeling and strength. Also, when it locks, my great boyfriend has a way of massaging my arm from my shoulder blade to my fingertips to make it unlock. Very little strength, but the movement is back. Not mine, but sister-in-law had a sore on her tongue. No one could figure out what it was for years. For a while doctors said it was nothing, then a doctor said it was shingles, but that was wrong. Turned out it was cancer that had been missed on 2 biopsies, before spreading. Every so often I get a lightning bolt feeling in my vagina. Sometimes it makes me orgasm out of nowhere. I've had multiple pregnancies and all the doctors say this is why. Nerve damage of some sort. But it's been happening since puberty. At first I thought my phone was electrocuting me. Lighting crotch. This was a big convo in my due date group. If I haven't eaten for 5 or more hours, stomach starts getting angry. Once I begin eating, my stomach gets really painful, like I'm hunched over the entire time, no matter how fast or slow I eat, and no matter the types of food I eat. It only subsides once everything finally digests about an hour after eating. The weird thing is I can skip breakfast, or have breakfast and have a late lunch, but it's only when dinner time comes that my stomach decides to throw a tantrum. The only solution is to eat snacks between, but there are circumstances where I can't. If I ever needed to fast, I guess I'll just die. All of me snaps, repeatedly. It started with my ankle popping endlessly, then my jaw, wrists, knees, and fingers, followed by hips and shoulders. A couple of years ago, I noticed I could pop my shoulder blades against my ribs. A few months ago, my sternum started popping randomly, not something I can repeatedly force, and now my elbows are popping with increasing frequency. Most of it is tendons or ligaments snapping over bones. Pretty sure some of it is just bone on bone grinding, and there's no good feeling or relief that goes along with it, like when you crack your back, but it's not painful either. Whatever it is, it's getting worse. And I've yet to encounter a doctor who isn't just like cool party trick and immediately moves on. This sounds a lot like Ehlers-Danlos syndrome. You should definitely talk to a doctor about EDS right away because it gets worse and worse over time. When I eat the same breakfast too many days in a row, I end up throwing it up. Once this is over, I feel fine, like nothing happened. It doesn't matter what I eat for breakfast. There's always a chance for it to happen. I have the feeling that I will throw up a few days before I actually throw up, as a kind of warning, I guess. When I told my doctor, she said that it might be heartburn, but I swear it's something else. Look up cyclic vomiting syndrome. I know someone who had trouble looking for a diagnosis and found this to be the cause. I have a rare condition called selective IgA deficiency. I have gotten sick constantly for 30 years. I'm talking about once a month, and it's really ruined my life. The thing is, no doctors even knew to test my immunoglobulins and just kept throwing antibiotics at me or saying it was allergies. When one doctor finally tested me, I realized my IgA level is at 0. Some people live just fine like this, but others constantly get sick. Like me. Unfortunately, there is no cure for this, unless you also lack IgA. Then you can get transfusions, which is still odd to me. Worst thing in the world, it's like I have no immune system. Hard to keep a job. Get sick with almost any germs, like I'm the bubble boy. Some advice for you, if you don't have one already, get yourself some medical alert jewelry. It's because some people with selective IgA deficiency need to have any blood transfusions irradiated due to having an anaphylactic reaction to the IgA antibodies in blood. Irradiating the blood takes out the antibodies and lowers the chance of it happening. Not really a problem per se, but I, and a large portion of my dad's family, was born without adult teeth under my front bottom baby teeth, so they never got pushed out. I'm 20 years old and I still have my bottom baby teeth that are usually the first to fall out. So does my dad. He might only have one now. I think one finally kicked the bucket. Weird little quirk in our DNA. One of a few anyways. My family has the opposite. My dad's side had 3 sets of teeth. 1. My incredible amount of aches and pain. Knees, ankles, toes, fingers, elbows. 2. My nose is sometimes so clear it hurts to breathe because air stings me. It's weird. For the second thing, your nose is always supposed to have a layer of mucus in it to protect the sensitive lining of the nose. The mucus traps air particles so your nose can figure out what the heck is in the air. Smell. Also why dogs' noses are always wet. When this happens your nose is probably almost completely dry, and so the lining can dry out and get chapped, cracked, like with chapped lips. Passing out in the shower. It's not that the shower is too hot, it just feels like the water is pushing down on me too hard. Passing out in the shower. That's dangerous as heck. Maybe wear a helmet when you shower. I have had 4 miscarriages in the last year. Have 2 healthy children from my only other pregnancies. No one can figure it out. Thanks for all your well wishes. I have done all the tests and absolutely nothing has come up with a red flag. I am also in the reproductive healthcare field, so it isn't like I'm not asking the right questions or don't know how to advocate for myself. Thank you for the advice. All these suggestions are great for others who are going through this, and boy do I wish my situation were as simple as any of these things. I'm sorry you're going through that. I cough a lot. I've been asked how much I smoke, not if I smoke, how much. I have never smoked in my life. I cough seemingly out of nowhere and fits can be bad enough. I've gotten quite dizzy. Every time I've gone to a doctor I've been told nothing's wrong. No obstructions in the lungs, no irritation, no asthma, no damage visible on an x-ray, no cancer. I just cough. It's not all the time. Sometimes I'll go a few days between coughing fits, but they'll show up again soon. My mom has the exact same problem. She's been coughing for at least 30 years. I think she told me it started after she got whooping cough, and the cough just never went away. It also seems like it gets triggered by random stuff, if her phone rings, or if she stubs her toe, really anything that bothers her, lol. She's even been to neurologists for it, but still haven't come up with anything. I get a weird allergic reaction to certain beers and wines, but not others. My throat and tongue swell up and get itchy and sore. I start having trouble breathing. I start dry coughing, hacking, and can't stop. My entire respiratory system just tries to leave my body. It's horrible while it's happening and lasts 6-8 hours each time. But it's not all beers or all wines, just certain brands, and I have no other reactions to anything else that shares ingredients. Doctor ran some tests, found nothing that would explain it. He just shrugged his shoulders and told me to avoid those brands. I felt horrible for about 4 months in 2014. Constant pain that moved around my body, unbearable fatigue. My joints were incredibly weak and unstable and constantly clunking and sticking. Limbs kept going numb. I was miserable. I went from doing cartwheels in December from barely being able to stand up in February. I was tested for everything from mono to Lyme to lupus to rheumatoid arthritis and more. At least 20 blood tests. Everything was normal, except my thyroid was a tad low, but that's worsened since, and yet I feel much better than I did then. I was diagnosed with a mild form of Ehlers-Danlos syndrome based on my pain, history of joint dislocation, and extreme flexibility. I do think I have that, but what seemed like a frightening decline in my condition righted itself sometime in the summer, and I've never felt like that since. So this was something more. I suspect low vitamin D may have played a role, though. Unidentified abdominal pain with no cause. MRI, CT, X-ray, ultrasound, blood tests, all negative. No Crohn's, celiac, IBS, cancer, just pain. It sucks. I lose weeks at a time curled into a little ball of pain. I have had so many weird issues. I'm convinced they're going to name a disease after me. My hands swell up and my palms itch sometimes. Remember those popcorn hands during Halloween? That's how swollen they feel. It only has happened when I'm out shopping and doesn't always happen at the same stores. It happens maybe 3-4 times a year. Unexplained horrific vaginal pain. Tested negative for everything under the sun. So many medications and home remedies looking for relief. Final diagnosis was Vulvodynia, just to give it a name. The whole reason I made this Reddit account. I finally found an answer to my unexplained collarbone pain. It would swell up and I couldn't bear the feeling of anything touching it. Reactive lymph node. And my shoulder hurts if I eat too much. Too quickly. What the frick? I have a lump at the base of my neck. Slightly off center. Sensitive to pressure but doesn't impact my day to day. A scan didn't show anything. Common spot for a lipoma, which is just a hunk of fatty tissue. I get a sudden sharp pain in my chest, usually in the same place but not always. It's triggered by inhaling or exhaling at a certain point. I can either breathe shallow for a few minutes not reaching that point until it passes, or force past it and I'll feel a little pop and everything is fine after. Look up pre-cordial catch syndrome. Severe muscle spasms in my upper back under my right shoulder blade. Been like this for years. Every new doctor I'm sent to acts like I'm making it up and I just need physical therapy. I've tried multiple times among other things. Then they look at it and go, oh yeah, I see what you mean. That's pretty bad. Then they do nothing. On top of that, I have chronic inflammation in most muscles, chronic hives, and severe fatigue. No idea if they're related but no answer so far. I've had the right shoulder muscle spasms too since I was 14. I'm 23 now. It feels like half a baseball in the top of my shoulder, and it is palpable and mobile if I shrug my shoulder. I've had x-rays and MRIs of my neck and shoulder, and they've seen nothing but soft tissue swelling. I was told it was because of my anxiety disorder and inability to stop tensing my muscles. Until I was like 20 I couldn't burp. It was kinda painful. Sometimes I would have to lean my body fully to one side to basically force the burp out, but it would only freaking come out like a low croaking sound, so then I felt like the weird freaking frog girl or something. I went to 2 doctors and they basically said, yeah, that's weird, take antacids. No burp. Unexplained tailbone pain. It gets severe stabbing pain when I get up from a seated position. I also get stabbing pains when I'm sitting down. An x-ray showed something, but that's all that's been told to me. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.